Tonight, a crisis rocks the Department of Health and Human Services, the agency charged with protecting America's health. The CDC, a key part of HHS, is at the center, its credibility and mission now under fire. A deep rift has formed between political leaders and career scientists. Over 1,000 HHS employees are demanding the resignation of Secretary Robert F. Kennedy Jr. This unprecedented move signals a profound clash over the future of U.S. health policy. The core dispute: should science or politics guide public health? Employees fear political ideology is replacing evidence-based science, risking millions of lives. Secretary Kennedy's history of questioning vaccine safety has fueled these tensions. Many staff now believe their worst fears are coming true. The conflict has erupted into open rebellion, with career professionals challenging their leader. The trust in America's health institutions hangs in the balance. The crisis exploded after the abrupt firing of CDC Director Monarez, less than a month into her tenure. Sources say Monarez refused Secretary Kennedy's order to restrict access to certain vaccines, including COVID-19 shots. She argued these changes lacked scientific support and endangered public health. Her dismissal triggered a wave of resignations. 4 senior CDC officials quit in protest. Hundreds of CDC employees staged a walkout, rallying behind Monarez. The CDC, now leaderless and shaken, faces a leadership vacuum at a critical time. The agency's ability to track outbreaks and guide the public is in question. The firing of Dr. Monarez has become a flashpoint, igniting a much larger firestorm. The turmoil threatens the CDC's core mission. Public health threats remain constant, but the agency's stability is now in doubt. The nation's top health agency is in unprecedented turmoil. The stakes for public safety have never been higher. The fallout has sparked a full-scale rebellion. Over 1,000 HHS employees have signed a letter demanding Secretary Kennedy's resignation, or his removal by the President and Congress. The letter accuses Kennedy of endangering American health and undermining the department's mission. It cites the firing of Dr. Monarez as proof that scientific integrity is being sacrificed for politics. The signers warn that health policy must be grounded in evidence, not ideology. Prominent figures including Senator Bernie Sanders have joined the call for Kennedy to step down. Sanders accuses Kennedy of promoting conspiracy theories and endangering public trust in vaccines. Critics argue that public health decisions must be based on rigorous science, especially for vaccines. They fear Kennedy is replacing evidence with personal beliefs, risking devastating consequences. The battle lines are drawn: science versus politics at the heart of public health. The future of vaccine policy and scientific integrity is at stake. The administration is fighting back, framing its actions as necessary reforms. HHS Communications Director Andrew Nixon insists the CDC needs fixing, and Kennedy is the reformer to do it. The White House stands by Kennedy, defending the firing of Dr. Monarez as a matter of policy alignment. Officials argue that the president's agenda must be implemented by agency leaders. Supporters say Kennedy is challenging a rigid bureaucracy and restoring public trust. They claim asking tough questions about vaccines is about transparency, not anti-science ideology. Critics, however, see these moves as an assault on public health foundations. For them, evidence-based science means following global consensus, which supports vaccine safety. They view Kennedy's actions as elevating fringe ideas over established science. The firing of Monarez is, to them, proof that scientific integrity is under attack. The administration and its critics are locked in a battle over the soul of public health. The stakes: trust, science, and the nation's health. The path forward is uncertain, and the stakes are enormous. Secretary Kennedy shows no sign of stepping down, with full White House support. Pressure mounts from HHS employees and Congress, with possible hearings ahead. The CDC remains without a permanent director, its leadership in disarray. Morale is low and the agency's crisis response could be compromised. Public trust in science and government is at risk, with confusion and mistrust growing. The credibility of America's health institutions may take years to rebuild. The nation stands at a crossroads: reform versus scientific consensus. The outcome will shape U.S. health policy for years to come. The health and safety of millions depend on the path chosen. We'll continue to follow this developing story.